Findings of a study which will be used to compare cancer patterns in the Latrobe Valley before and after the Hazelwood mine fire have been released. Among the results were higher liver cancer rates among women, which researchers say came as a surprise. Alexandria Zatsamakis reports.
More than 3 years after the mine fire disaster, Gippsland residents are a step closer to learning about its health effects. Results of a baseline cancer study have been released.
We extracted 5 years of cancer reporting data from the Victorian Cancer Registry, who has very complete cancer information.
Monash University researchers found in the 5 years prior to the fire there were elevated levels of lung, liver, blood and bladder cancer among women and men in Latrobe City.
Some of the potentially smoking related cancers were a surprise. The liver cancer was quite a surprise, and perhaps that's something that needs some further follow-up.
The study also identified higher rates of mesothelioma in Latrobe City men compared to the state average for regional and rural Victoria.
This is not a shock to me, and it certainly isn't a shock to the people that I look after. It's everywhere, and it's not just power stations.
The data will be used as a baseline to compare cancer rates in Latrobe City before and after the Hazelwood mine fire, with the aim of helping determine whether cancer incidents could be linked to the 2014 blaze. A major report on the findings is expected to be released around 2023.
We're going to be doing these data extractions regularly over the next 10 more years.
Alexandria Zatsamakis, 9 News.
It's been found certain types of cancer were more prevalent in Latrobe City than surrounding areas before the Morwell mine fire. The Hazelwood Health Study has highlighted well-documented asbestos-related illness and some unexpected results.
It's no shock asbestos-related cancer was rife among men in Latrobe City prior to the Hazelwood mine fire.
There's been quite a lot of asbestos exposure in the valley, in the power industry, but also potentially in people's homes as well.
We actually orchestrated a health study here a considerable amount of time ago now, and at that time asbestos sufferers, or mesothelioma, was 7 times the state average in Latrobe Valley.
Inflated rates of lung, liver and blood cancer in females and bladder cancer in men less expected.
The others are a little more difficult to explain because we don't know anything about smoking rates, and clearly bladder and lung cancer are related to those.
A recent Environmental Justice Australia report found communities close to coal-fired power generation like Morwell were exposed to a range of toxic substances with a higher risk of cancer and respiratory disease.
Well, certainly particulate and polycyclic aromatics that are part of smoke, bushfire smoke and other forms of smoke can certainly increase the risk of both lung and bladder cancer.
You may see a drop-off on that. With our power industry closing, we're not going to have the same pollution that we've been living with for the last 80, 90 years.
The study will now examine post-mine fire data for comparison. Anecdotal evidence already pointing to a decline in health for asbestos victims.
All the ones that I've had under my wing during that mine fire and that are still here with us all have more majorly concerning respiratory problems on top of what they already had.
Sam Darroch, Win News.